How should localities organize outreach and informational resources to assist the population prior to a chronic or acute situation? This is a long-term care question.
Well, long-term care, of course, is not very much discussed in this current healthcare debate as far as I can see, which is most unfortunate because we are a society that's growing older. As I think I mentioned this morning, we are going to have the baby boomers in no time flat constitute the largest generation of older people we've ever had. In just less than 20 years, older people will make up 20% of the population. That means 1 out of every 4 adults. When you got to dinner, you got to be there with 1 out of every 4 people who got to be over 65. And 1 out of 5 taking children into account. So it's a very major change in society, and for us to not address long-term care is a mistake. And long-term care is not just nursing homes, but also care outside, where you remain in your own home, where you have to have well-trained home health aides, or even if you are a volunteer family member, you need to have some training, how to lift a patient, how to handle medications. All of that requires some skill.
Okay, and this last one, I've never heard of that. How do you feel about the use of a whole body vibration exercise machine?
I don't know.
Who wrote that question? I've never heard of that. The person who asked it, could they speak to it? Come on up. Okay.
I don't know much about it myself. That's why I was wondering if the doctor looked at it. But what I do know was developed by the cosmonauts and used by the astronauts because they, in space, don't use their muscles a lot, and they were getting blood clots, and this machine was helping them out. So what I read on it for studies that have done at the university, that it's very good for the elderly because it helps with strength, circulation, mobility, I mean, a whole host of things that it helps with. So I just wanted to hear from a professional what he thought.
Well, I have to admit, I don't know about that particular machine, but the idea of a little vibration sounds pretty good to me. No details.
That was the last of the questions that were written down. I think we have a little bit more time. Is there anybody in the in the audience who has a question that they'd like to ask?
How could anybody top that one?
Yes.
What's the best action we can take to help the health thing that's going on today?
Okay. What's the best?
Send emails?
What's the best action that one could take in terms of the health reform and what's going on in the administration?
Well, the usual answer is to be in touch with your local member of Congress and your local senator, and to let them know exactly how you feel. And I don't want to presume how you feel, but I'd be telling my local congressman that I want public option.
Yes.
When I was teaching in medical school, you were talking about not having geriatric departments, but the students weren't interested in it. I mean, even if you had an elective in it, very few students would opt that way. So is it the issue of not having enough departments, or not having a society that's interested in the elderly?
What we found out, did everybody hear the question? Okay. Well, we found out in our medical school that once the medical students saw what they could do and the benevolent effect that their even modest intervention had on the quality of life of older people, they became very interested. The other thing is I set up a healthy older person clinic. So my reasoning was that maybe no one would go into pediatrics if all they saw was Down syndrome and children close to death. So if you only give older people who are sick or have dementia or deteriorated, and don't give them an introduction to healthy older people, it would be hard to get them interested. So we had a relationship. I don't know if you're familiar with a famous Y in New York called the 92nd Street Y. And they have what's called a healthy old persons or senior clinic, not clinic, program. They had something like, I think, 600 people over 65 that were members. They're all active, great people. And we had them come and be interviewed by the medical students. So the medical students realized these are vibrant, healthy people. and that the fact that you're old doesn't automatically mean you're finished. So I think there are ways around. You're quite right that if you just presented sick, dying people, it might be darn hard to get them interested. But if you introduce them to the whole variation of the human condition, that makes a huge difference. And we got to be very popular. We got just as good ratings in our department as the other departments. I never said which ones because that wouldn't have been politically a good idea, but we did very well.
There was a question over here.
How did we Americans become a culture that believes in giving our dogs shots, the best of medical care, and then not find ways to serve poor children and poor people?
Could you help me because I have a little hearing impairment?
Say that again. Why don't you come on up? It's a long question, so come on right up.
Well,
he's got a lavalier.
I can thank a Presbyterian minister for this sermon. He wasn't employed by the church, so he felt free. He was a professor at Middlebury College to speak to the issue of health care, that we need some kind of health care improvement in this country, and you gave us statistics. And his theme was, we give our dogs and our cats shots and the best of medical care, but we have a large segment of the population that wants to turn away children and others from getting the very same services we give our dogs and cats.
Well, I personally, as a physician, from the very beginning of my career, which goes back a long time, 1953, 55, I just always thought that it was not right that this richest country in the world should be the only industrialized country that did not have national health insurance, covering, of course, children and older people, everybody. So that's always been my point of view. And politically, it's been very difficult. Teddy Roosevelt, believe it or not, a Republican president, in 1912 called for universal health insurance. And here we are, almost 100 years later, we're still not there. It's just amazing to me.
Time for a couple more, if there's any other questions. Oh, yes.
Why is it that medical schools aren't looking at it as show them a healthy senior and trying to go that route? Because the need for geriatrics is so great now that in the next 10 to 20 years, we don't have the resources now, never mind even having anybody specializing in geriatric psychology even.
Some of it is the chicken and the egg problem. You can't really teach it unless you've got the teachers. And we've just been so slow in building the teaching workforce that, to tell you the truth, if all 145 medical schools said right today, we want to have a department, there wouldn't be the people to run the department, said to carry out the teaching program. So we've got a real chicken and egg problem. It's going to take some time, I'm afraid, before we build up. It doesn't have to take as long as it's presently taking, however. It could be speeded up by having scholarship and fellowship programs that are more appropriate to encourage people to go into the field. But it's not going to be easy. That's why I said earlier that while I believe the baby boomers are going to be very transformative, I'm not sure they will themselves benefit as much as they should, because you can't just suddenly solve Alzheimer's disease. You can't just suddenly have doctors well trained to take care of older people. It all takes time.